Our next story is about lung cancer. Heavy story for a Monday, I know, but trust me, this one has a happy ending. You already know that lung cancer is a public health crisis. It is the deadliest kind of cancer, the world's leading cause of cancer death. It kills about 1.8 million people every year. But this could all change very soon. A new global research is out. It studied the effects of a medicine over the span of a decade. And it says that this pill halves the risk of death from lung cancer. Now, a reduction of 50% is a big deal for any disease, but in the case of lung cancer, it is even more thrilling because this cancer is resistant to most therapies. And now it seems to have met its match. Our next report tells you more.
Cancer is devious. It's a disease in which cells in the body grow out of control. Cancer in the lungs is mainly caused by cigarette smoking. Lung cancer is the world's leading cause of cancer deaths. About 1.8 million people die each year because of it. Hungary, Serbia, and France have the highest rates of lung cancer cases. The US saw over 230,000 cases of lung cancer in 2018. What about India? During the same year, India saw about 68,000 cases, and this number is on the rise. Compared to the situation just a decade ago, here's a grim prediction. India is likely to witness a 7-fold rise in cases of lung cancer by 2025. So while the data is different for different countries, one thing is common for all. Lung cancer is a hidden public health emergency. And for decades now, scientists have tried to fight its statistics. They've developed aggressive therapies. They've tried to catch it early to increase the chances of patient survival. Now, they use artificial intelligence tools as well. Snake-like robots that can slither down humans' lungs. But despite arduous efforts, lung cancer continues to persist. So scientists develop something different, which has less to do with catching the disease and more with combating the repercussions. They created a wonder pill, if we may say so. It's a medicine called osimertinib, and it may have a complicated name, but it has one simple mission: to reduce the risk of death by lung cancer. Does it really work? Well, the result might surprise you. Yale University conducted research on the effects of the pill. They studied it for a decade, and now their report is out. It says that this pill a day keeps the risk of death away. Literally, this drug reduces the risk of death from lung cancer by 51%. It has to be taken daily, but it only works on a certain type of lung cancer. It's called a non-small cell cancer, which is the most common type. It affects about 10 to 25% of lung cancer patients in the US and Europe, and 30 to 40% in Asia. So effectively, this pill can reduce the risk of death by half. And expectedly, this news has created quite a stir. Doctors are calling it thrilling, not a word that they use often, because halving the risk of death in any disease is revolutionary. But in the case of lung cancer, it's even more so. Why? Because lung cancer is resistant to therapies, and for most patients in advanced stages, there is no cure. So this drug could save the lives of millions across the world. Patients in the UK, US, and some other countries are already able to access it. It has been administered to 700,000 people, and after this new study, doctors expect this pill to become the standard of care. A groundbreaking drug to save countless lives. It could help about a quarter of lung cancer patients worldwide each year. And more than anything, this medicine is a beacon of hope. It can greatly improve the odds of survival in lung cancer patients. So this wonder pill is nothing short of life-changing.